All right, today in the Dr. Conrad Murray trial, the defense team tried to paint Michael Jackson as an addict. They claim he was addicted to Demerol. And joining us in studio tonight, someone who's familiar with the case here, addiction specialist and former anesthesiologist, Dr. Gregory Smith. Thank you for coming in.
No problem.
You know, what is Demerol? We hear about it, but for people who are not familiar with prescription drugs, first of all, is it a prescription drug?
Well, Demerol is a controlled substance. It's a narcotic like morphine, usually given IV or intramuscular, again, in a controlled setting.
When you say controlled setting, is that something an anesthesiologist would use?
Well, you know, you see this in anesthesia, but you also see it in doctor's offices. So, for instance, like in a plastic surgery office, if they're doing a procedure, sometimes people will use Demerol. Not my first choice, but it is a very strong painkiller.
If you had a surgery, is that something that a physician would prescribe as a painkiller if you had, I don't know what kind of surgery, but something where you needed a painkiller?
Well, it's
is it like a Vicodin?
Well, it's an old drug. It's not like a Vicodin. It's stronger. It's an old drug, and historically it's been given after surgery. So a person comes out of surgery and they'll get a dose of Demerol for postoperative pain. That's its historical use.
Is it something you would take home with you?
No, not likely. There is a pill form of Demerol, but it doesn't work that good. So, and there's a lot better choices. So most people don't even use Demerol outside of a hospital or a surgery center type setting.
Knowing what you know about the case and what you've seen so far, would it surprise you to know that Michael Jackson had Demerol in his system?
Well, you know, I watched a lot of the trial today, like a lot of people, and I saw where he had gotten a lot of Demerol injections, and Demerol is potent, but it also is very short-acting. So it's not surprising that it didn't show up in his toxicology, because it would only last a few, 4, 6, 8 hours, something like that, and then it starts to get out of your system.
Is it like propofol?
No, it's not like propofol. It is a narcotic. It is a narcotic, but I don't think it really had anything to do with this man's death. I mean, it wasn't even in his system when he died.
Well, they were trying to make the connection between Demerol and not being able to sleep.
Yeah.
Is that something that's a side effect of Demerol?
Well,
insomnia?
Once again, I think it's just sort of, just reaching at straws here to get a better defense for Dr. Murray, because a lack of Demerol or lack of any drug that someone's used to having can cause some sleep disturbance or insomnia. But once again, I don't think it explains the whole picture with what happened with Michael Jackson.
The defense was also trying to make a distinction between dependence on drugs and addiction to drugs.
Right.
Is there really that much of a chasm between the two?
There's a fine line between dependence and addiction. I think a lot of people that have chronic pain that are taking medication because they have to are more dependent. But certainly a narcotic like Demerol, you can actually totally be addicted to that drug, because it is a very strong, it's just not much difference between that and morphine or heroin.
You know, it sort of boils down to something we saw with Anna Nicole Smith.
Yes.
I mean, if you see the number of doctors that treated Michael Jackson over the years, it brings up this issue of perhaps doctor shopping. From your vantage point, because you are an addiction specialist who really deals with prescription drugs.
Yes.
Do you see or hear a lot of that?
Well, he was using a lot of aliases, which is common for a celebrity. But again, it's worrisome when someone's getting medication under 10, 15 different names, different doctors, different pharmacies. So I don't think there's any doubt that there was a problem with an addiction problem with Michael Jackson. But I think, again, it's not the point. I don't think that's what really killed him. Demerol wasn't in his system, but it is definitely an addicting drug.
Okay, anything we missed, anything you'd like to add?
Well, I just think it's wrong that other people are being sort of blamed for his death. When I look at the amount of Demerol he was getting, 200 milligrams, 300 milligrams, these are big doses, especially for a guy that probably weighed 115, 130 pounds, something like that. And so to get that kind of Demerol for a Restylane or a Botox injection, not appropriate. But once again, Dr. Klein's not on trial here. I think Dr. Murray is the one on trial, and that is not what killed Michael Jackson. It was the combination of the propofol and the other drugs that was in his system that killed Michael Jackson.
Explain to people who are listening the whole propofol issue. We've talked about it several times. What does propofol do to your body?
Propofol simply makes you go to sleep. It is an anesthetic. It is designed to make people lose consciousness, and at higher doses it can make you stop breathing. And I've always contended here from the very beginning that the amount of propofol that was given to him could not have been such a small amount. I think that he got a larger amount, and that was actually brought out today, that if you look at the doses that Dr. Murray said that he gave, it would not have killed anybody. So if he had given a lot more propofol, because again, no medical records, no monitoring, if he had given enough propofol, I think that's what put him over the edge, made him stop breathing, and he didn't wake up.
You're an anesthesiologist, board
Yes.
certified. How many times would you say you've used propofol in your career?
I've given it to thousands of people, and I've also helped thousands of people with addiction, so I've been on both sides of the fence here, and that's why this whole trial for me is troubling, because I think it's a big waste of time. I think that it is clear that this was an egregious malpractice and just not good care at all for a man that should still be alive today.
Everybody gets their day in
Yeah.
court, however.
Absolutely.
All right, thanks so much for coming in.
Thank you. Thank you.
We will, as always, have live gavel-to-gavel coverage right here on our digital channel 4.2, California Nonstop. And we're streaming the trial on our website as well, NBCLA.com. You can join in the conversation on our Facebook page and Twitter.